Nice weather.
Or getting up and having something to do, yes.
Not being in pain with my hip.
I'm good spirits.
Coming to work, I think, yes.
Going for a nice walk without getting exhausted.
And I'm able to think clearly.
What made me feel safe and comfortable is that I did have COVID. I was at my mum's house, and it's just nice just having her around, you know.
I can always fall back on my family and friends.
Having the right support around me, that's very important.
It's just having the comfort, just having her there with me, you know.
Lucky comforts me when I'm not well, because he stays on the side of the bed.
Someone who you know and someone who knows you, and just to make you feel happy and safe, and knows what you like to eat and knows the things what you like and all that. And
My books.
To put on a nice DVD or listen to an audio book.
I've got a lot of DVDs which I can watch, or I'm able just to have some quiet time and think and reflect.
Sometimes it's difficult being in hospital.
The good part of it is I would be in capable hands.
Doctors and nurses might not understand me if I need help.
From watching a hospital dramas like Casualty, Harbour City, there's a term, crashing. I don't know what that means, but it's making me wary of hospitals.
Too busy, noisy. I would just love to be in my own bed where I feel safe.
I'm surrounded by family and friends. Friends of a friend comes to visit.
Being here and with my family and friends around me.
yes, I live by myself, so that could be quite hard. It could be quite lonely if I stay on my own. In fact, lying in my bed on my own, you know.
What would be hard for me is watching family and friends and watching them see me like this and knowing how hard it would be for them watching me deteriorate. I wouldn't want to put them through it.
If I was very, very ill and coming to the end of my life and it wasn't suitable for me to be here, then I would have to go into maybe a hospice which I'll refer to go into a hospice rather than be in a hospital.
A hospice would be good to be in, because then you wouldn't be on your own. In fact, you have people around you. In fact, can help you with what you need help with.
Because I'm being cared for and I'm not hooked up to machines.
Because a hospice would be nice and calm and I'll be in my own room with my things about me.
When the time comes, you definitely have someone with you to look after you, yes. Because that's all we want, is to be cared for and to be, yeah. I don't know about that one.
I know I'm going to need lots of support and lots of people.
Bit of a difficult one, that is, yes.
I wouldn't say it'd be difficult, but it would be intriguing.
That's your private space, that is, and you're letting someone into your private space.
If I don't need all those people, then I'd prefer not to have lots of people around me.
Yeah, I'm not too sure about nurses, really.
From what I've watched on TV, it's always been done in a hospital, nursing home, or hospice.
I guess they would have to come, if you needed that, they would need to come, but...
It would be better to have the same nurse or doctor.
We probably could just have one or two nurses, yes. And the same area, the same ones, so they get to know you and you get to know them.
Because it would get confusing if I have different people and they introduce themselves and then I have to introduce myself again.
Because they like to do some really quite personal things which you don't want every Tom, Dick or Harry to be doing, yes. If I was the king, I'd have a helicopter. I would take me everywhere, but I am not the king, so I would have to use a taxi or a train or the bus, yes.
I have to get a cab to go to the hospital.
No, you don't. Or private jet. No. Oh dear me.
I think it'd be pretty awful if you had to have one of them and it goes down in your tummy and you have to have then that special liquid to have.
No, this would be a new experience.
Well, I don't think I like that very much. No, that looks a bit uncomfortable, that does, yes.
I don't like having an operation unless I really truly have to have an operation.
If you need an operation, it's good to have the operation because it gets rid of what, hopefully it gets rid of the bad thing what's inside.
I get very anxious and nervous and I always need a lot of support.
So it depends on reassurance.
I don't know if I've ever told you this, but when I was little I couldn't walk till I was 12 years old. I used a wheelchair. Yeah.
So for you being able to walk is such an important big achievement then?
It is. I would hate being in a wheelchair.
The wheelchair I'm not sure about.
If it's a case of sitting inside and not seeing the fresh air or something, it's good to get outside. Yeah, no, if I need one, I would use one. I would, yes.
I just want to cross that bridge when it happens. I want to go out and be outside as much as possible.
think if I need that kind of help, because I'm a man, it might be. I think I would feel a bit uncomfortable with having any Tom, Dick, or Harry doing that. You know, that I would really want someone who I could trust, who could fit, because that's very personal. That is, yes.
If it was a new carer, I would have to get used to them first before, and they would have to get used to me as well, so it works both ways. My family, my friends.
The one who I would definitely really want to say goodbye to is my mum, yes, you know, but I would be really upset or hurt if I wasn't there for that, you know.
And I definitely want Lucky to be with me if something happens to me and I pass away.
Family and friends and my colleagues, I want them as well to be around me.
As I say to people, that she's everybody's friend, she is, but she's my mum, she is, you know. That.
And I just hoped that I would just close my eyes and think about being with my mum, and then she comes to me like an angel, and then I go and be with her.
Oh, we've got to go to Hanky's house. It's going to be a loss.
Meet the King. Yes, no, definitely Meet the King. That would be definitely on the list. Yes, that's it. Yes, taking hands and for putting the medal on me. Yes, and no, definitely Meeting the King. Yes.
Number one on that list is to visit Ireland.
And his son, yes, Prince William, yes, as well, yes. Well, all of them really, yes, but the King would be top on the list, yes.
Just have fun. Do go out and have fun.
So I would like to see my sister get married, if she chooses to.
Go to different countries. I would like to go to Canada as well.
I think I'd like to go out for walks if I can still do that.
And maybe go back to America one day.
I'd like to go and see the sea, I would.
Remembering and reflecting on every family event, every really good moments in my life.
Go to the theatre, see shows and...
Going to go see shows, so...
I like this musical called Blood Brothers, I do, yes. So I'd like to see that. And
like it's just normal day, talking, laughing, and just a really positive, happy atmosphere.
or maybe a helicopter ride, yeah, to continue to do things what I can do until I can't do them no more, yes.
Other things I would like to have happen and to do before I take my final journey.
If I've got to meet the King and this fact, I could probably go quietly, then I could, yes. Then I could say, I've done it, I have, yes.
only get one life, and you got to live that life to the fullest, because you don't know what's around the corner.